How would you respond to someone who may be having an episode with dementia?
She's saying I ran over her.
The man driving this car said this woman walked right out in front of him and wouldn't let him pass.
Sir, come on. This is unbelievable, man.
First responders are usually called in cases like this. However, there is no cut and dried answer as to what to do.
Well, I'm just telling you.
I have done nothing wrong.
We can't expect our law enforcement officers to go out there and take someone into custody, which is what we're being asked to do, and take them and get them to a home or force them into a home when, unfortunately, in order to get to that level, the person has to be extremely a danger to themselves. Rather, the code reads a significant threat.
A panel of professionals gathered for the first time in St. George to talk about how to address some of the underlying issues in dealing with those with dementia.
Our particular community, we have so many people that are suffering from dementia, and with all of us baby boomers moving into the area, it's the amount of calls to the police department and the fire department, 911, is just escalating.
People with dementia don't reason the same way as others. The number of these 911 calls have gone up significantly over the past 25 years.
When I first started, it was a rarity. We might get called once a month or to a subject with dementia or Alzheimer's or some other aging ailment. Now it seems to be almost on a daily basis.
An estimated 1 in 8 people aged 65 or older will get dementia. At age 85, 50% will already have it. Currently, there are 6 million people in the United States with Alzheimer's disease.
In about 2050, it's set to explode about threefold. It's going to go to around 15 to 20 million. We have a real problem on our hands, and the sad reality is that it's grossly underfunded.
Dementia isn't a disease, rather it's a syndrome. There are 9 different types of dementia. Alzheimer's is the most common. While Alzheimer's is a disease unto itself, there is no one cause. The average life expectancy for a patient with Alzheimer's is about 8 to 10 years. Brain scans show the difference between a person who has Alzheimer's and one who does not.
Atrophy is simply shrinkage of the brain. Now, folks, atrophy happens as we get older.
Dr. Kyle Gulbranson is the only geriatrician in this area. He says knowledge of the elderly and response to medications is important no matter what field of practice a doctor is in.
Surgery, ear, nose, and throat, whatever specialty you think you're going to go into, it's good just to have an idea of how to deal with dementia and how to deal with patients who are older and prescribing medications.
Doctors say it's important to have the correct diagnosis of what type of dementia, as medical treatment will vary.
The caveat here is that the medication can be catastrophic and even fatal. So that's where diagnosis is incredibly important for this one here.
It's often the caregivers that have the toughest time in dealing with dementia of their loved ones. Those who attended the summit were grateful for the information on resources available.
My mother-in-law is currently, we think, in the early stages of dementia. She lives out of state. We're here. We're caregivers far away. So when I saw the poster for this, I thought I could come and learn something from all the different, they said all the different speakers they were going to have. I could learn something that could maybe help me as we deal with this long distance.
Homes for dementia and Alzheimer's may be the answer during the end stages of the disease, but it's up to the family members or friends to try and get the patient the help before it becomes a problem that law enforcement has to deal with.
And so it's my hope that from this, we'll be able to get a task force together with these agencies and create policies and procedures on dementia calls.
That next level of care has to be followed through with community partners and, even more importantly, family members.
For more information, contact Memory Matters of Utah and Nevada. In St. George, Melissa Anderson, Community Education News.